Hello, everybody. This is Dr. Anshul Gupta. I'm a functional medicine MD who specializes in thyroid disorders and Hashimoto's disease. I've written a bestseller book called Reversing Hashimoto's, where I've discussed a three-step process to reverse thyroid conditions. And I'm going to discuss or share with you this three-step process today, which is completely natural and based on functional medicine research. So let's delve directly into this three-step process so you know what you're talking about. So as a background, I'm a Cleveland Clinic physician. That's where I did my research into thyroid disorders and made this three-step process. So what are we going to learn today? So first, we are going to learn about what symptoms thyroid patients have and why these symptoms exist even after taking medications. Research now tells us that even after taking medications, several people continue to have symptoms. And that's what we're going to talk about today. Why? What are the underlying causes of thyroid disorders? You might have been wondering, or you might have asked your doctor this question: why did I get thyroid disorder? And your doctor might have just said, well, we don't know. It just happens. But in reality, there is research that tells us there are certain causes of thyroid disorders, and we are going to discuss about that today. Now, once you know what are your triggers or root causes, what can you do to improve them? And that's where we're going to talk about this process where I've developed that has helped several people to improve, reverse their thyroid disorders. So, introduction to thyroid, basically, thyroid disorders are increasing rapidly. In the last decade, we have seen a very big upsurge of thyroid patients. More and more people are being diagnosed with thyroid disorders, and less people are getting better with medications. Different disorders are there of thyroid, which includes hypothyroidism or low thyroid or Hashimoto's disease. People are getting diagnosed with goiter or thyroid nodules or even Graves' disease. Now, these thyroid disorders mainly affect middle aged females between the age of 30 to 65 years of age. But again, as we are seeing an increased trend, so what we are also seeing is that more and more males are being diagnosed with thyroid disorders. And even in children, we are seeing a big surge of thyroid disorders, especially Hashimoto's disease. More and more kids around 8 to 9 years of age or 10 years of age are being diagnosed with thyroid disorders and Hashimoto's disease, which is very alarming. The worst about thyroid disorders is that, the symptoms which it comes with. There are so many dreadful symptoms or difficult symptoms that people with thyroid disorders go through, and sometimes the medications are not able to resolve these symptoms. So generally, the symptoms of thyroid disorders are feeling tired or feeling fatigued. Brain fog is another major symptoms. What that means is that people are forgetting things or their mental capacity is not at par as before. They are not able to concentrate on things as best. The other problem is weight issues. Several thyroid patients are unable to lose weight. They keep on gaining weight even though they have tried different kinds of diets or lifestyle changes. Hair loss or hair thinning. This is again a major symptom a lot of thyroid patients go through. Gut issues like constipation, bloating, stomach cramping, diarrhea, you name it. So many gut related symptoms are associated with thyroid disorders. Mood changes. Several people complain of being depressed or anxious or going from anxiety to depression or always stressed out. So mood changes are also a major reason of thyroid disorders. Infertility. Again, infertility cases are on a rise very rapidly, and thyroid issues definitely are very major reason of infertility. So these are just some basic symptoms that we have gone through. Obviously, there are much more symptoms which are associated with thyroid disorders, but most people go through these symptoms or sometimes only one or two symptoms. Now, what is the most conventional way of treating thyroid disorders? Because majority of the cases of thyroid disorders are either hypothyroidism or Hashimoto's disease, and the treatment is only one, giving them levothyroxine, which is a thyroid hormone, which is a synthetic thyroid hormone. No explanation is given why they develop thyroid or why you develop thyroid, what is going on with you, why you need this medicine suddenly in your life. And the worst part, This medicine doesn't even work for a lot of patients. What that means is that your lab values definitely will look good, but your body might not be functioning at optimal, that your symptoms might still exist, or they might improve slightly, but they will not go away completely. In fact, there has been research studies which have shown that people who have been taking levothyroxine still have symptoms which are not better. So here are a couple of studies. One study was done in UK, which showed that people with thyroid disorders, when they were put on thyroid medicine, 40%, more than 40% of patients in this research study showed that they still had one or the other unresolved symptoms and they were not getting better, which was shocking. And there was another study done, which was mainly looking at neurocognitive symptoms like brain fog symptoms of not able to concentrate or feeling depressed or anxious or brain loss or memory loss. And this showed that with adequate treatment, that means their doctor was giving them the medicine which was required and the lab values are absolutely normal. And even then, these symptoms did not improve for these patients. So this is very shocking. Okay. It might not be shocking for you because you are going through these symptoms. You might have gone to your doctors and told them about it, but the doctors might have said, well, we cannot do anything else. They might have even come to the point that they might have told you that you might be thinking all these symptoms or making these symptoms up in your head. But in reality, these are not fake things. The research now does tell us, and you can actually show them this research saying that, okay, well, I'm not alone. There are several people like me who are taking the medicine and still not feeling better. So the question is that why is conventional medicine failing? Why is that this medicine is not working? Why is that, they're not paying attention to what you are telling them, because you are suffering. So conventional medicine, unfortunately, still strongly believes that levothyroxine is the only solution. Levothyroxine was discovered a very, very long time ago, and they are not putting any new research into the thyroid disorders to look more of why this is happening and why levothyroxine is not working. They are not looking for underlying reasons for thyroid disorders. When first thyroid disorders were discovered, they were discovered because of iodine deficiency. And because of iodine deficiency, the thyroid was not able to make enough thyroid hormone, and that's the reason external thyroid hormone was useful. But now, in the last 5 to 10 years, the major reason of hypothyroidism is not iodine deficiency, because now most people are actually getting enough iodine through either table salt or either through food or other fortified food. The major reason of current hypothyroidism epidemic is Hashimoto disease, is an autoimmune condition. And levothyroxine doesn't do anything for Hashimoto disease or autoimmune conditions. And that's the reason this medicine is not working anymore. Most doctors are not concerned about the symptoms, actually. That is very sad to hear that doctors are not paying attention to the symptoms of their patients. Or sometimes they just feel helpless because they don't have any other tool to help their patients because the only treatment available to them is the levothyroxine. But as a patient, you feel frustrated, you feel angry, and sometimes with no hope. So this is a very scary picture that a lot of people go through. Now, let's talk about why. Why is that people with thyroid disorders are not feeling better? So, as I shared with you, the current research tells us that the majority of the thyroid patients now these days have autoimmune thyroid conditions like Hashimoto's and Graves' disease. The worst part, most of the conventional doctors are not even checking for Hashimoto's disease. Most people, when they start working with me, I ask them, do you have Hashimoto's disease? And they said, we don't know. We have never been checked. Or some people who have been checked, they were checked like a long time ago and nobody monitors their antibodies anymore. So again, it is very important to know what kind of thyroid disorders you have. Do you have Hashimoto's or not? And it's a very easy test. Any conventional labs will do a Hashimoto's test, which is basically checking thyroid antibodies like thyroid peroxidase antibody or thyroglobulin antibodies. So if you can ask your doctor to do it, they should be able to run it. And you will know that whether you have Hashimoto's disease, which is the underlying problem of your thyroid disorder or not. But the shocking research says that more than 70 to 90% of patients now these days, the underlying problem is inflammation or Hashimoto's disease and not iodine deficiency. The underlying problem is inflammation and not the deficiency of this thyroid hormone that we think that we have. Suddenly, your thyroid doesn't stop producing thyroid hormone. There has to be a reason. And the reason is this autoimmune destruction of your thyroid gland and other organs in your body, which causes Hashimoto's, which ultimately leads to hypothyroidism. Now, the interesting part is that this inflammation and autoimmunity, most people think they only destroy the thyroid gland. But in reality, it's actually based on my research. What I found was that it destroys something called mitothyroid connection, which is a connection between your mitochondria and your thyroid. So it destroys both of these things, and that's the reason you get these symptoms. And again, just replacing thyroid hormone doesn't fix this. So let's talk about what is mitochondria and what is this mitothyroid connection that we are talking about. So mitochondria are teeny tiny organelles which are present in each and every cell of your body. Now, mitochondria, the most common way they are known is they are called as a powerhouse of the cell or the body. Your body gets energy from mitochondria. Mitochondria produces energy, and that's the reason you can function. Now, most people don't know that thyroid hormone and mitochondria shares a mutual relationship. Thyroid hormone controls mitochondrial health. It regulates mitochondriogenesis, basically, where what it means is that it helps in dividing mitochondria, regenerating mitochondria, and it also regulates the metabolic functioning of the mitochondria. What does mitochondria does? Mitochondria in turn regulates the oxidative balance in the thyroid gland by regulating the production of reactive oxygen species. Basically, mitochondria actually oxidative balance is what we call as the balance in the body, which helps the thyroid gland to function properly and not let it being destroyed. Whenever, like you can compare it to a factory. In a factory, you are producing any kind of goods, right? And when you're producing any goods, there is a lot of waste material that happens with any production. This waste material, if it accumulates in the factory and not being deployed properly, then the accumulation of waste material can impact the factory production and in fact might stop it because it might clog the whole factory. So same thing when your thyroid is producing thyroid hormone, it produces certain reactive oxygen species, which if it accumulates, destroys your thyroid gland. And mitochondria helps to get rid of those reactive oxygen species and in turn keeps the machinery of thyroid gland functioning. So you see mitochondria is so much important for thyroid and thyroid is also important for mitochondria. Now, let's look what the research says that what is the exact reason that why is people developing thyroid disorders and what is the actual thing on the microscope level which is happening in the thyroid disease, the pathology. So as I said, like a majority of thyroid disease are autoimmune in nature, where antibodies, your own body are producing these antibodies, and your environment is creating these triggers to produce these antibodies. And these antibodies start destroying your own body, especially the thyroid gland. But if you go much more deeper, the research actually shows that in thyroid gland, these antibodies not only lead to the destruction of the thyroid tissue, but also lead to the destruction of mitochondria. In fact, electron microscopy, it shows that in Hashimoto's patients or in thyroid disorder patients, when they were looking through electron microscopy, most of the thyroid cells, they had a very, very high number of accumulation of dysfunctional or dead mitochondria as compared to general population. So this is telling us that definitely thyroid disorder patients in thyroid glands have very, very high amount of destruction of mitochondria and thyroid cells. So it is a destruction not only of thyroid, but also mitochondria, which is happening beneath that you are not even aware of. And what people don't know is that the thyroid symptoms are actually mitochondrial symptoms. Research, has shown and have been associated with several mitochondrial function with several symptoms. And all of the thyroid related symptoms are actually associated with mitochondrial functioning. As I said, fatigue or being tired. Now, mitochondria is a powerhouse of the cell. It is producing energy. Now, if the mitochondria is not functioning, what do you feel? You feel tired. That's the reason thyroid patients feel fatigued. Weight gain, mitochondria is responsible again for burning all this fat and carbohydrate that you consume. And if it is not able to function, that's the reason people gain weight or not able to lose weight, right? Feeling cold, that is another symptom. Mitochondria, when it is producing energy, it also produces heat. And that's the reason you feel warm. And again, if mitochondria is not functioning, that is not happening. Brain fog, the highest concentration of mitochondria in the whole body is in brain. Brain gets all its energy from mitochondria. And obviously, the mitochondria is not working in the brain. That's the reason brain is not working. Same with constipation. Again, like your gut needs a lot of mitochondria. And then when mitochondria is not working, then your gut doesn't work. So most people are not even aware that the thyroid symptoms are not thyroid symptoms, but actually destruction of mitochondrial symptoms. And levothyroxine, which is the thyroid hormone, is not doing anything to safeguard mitochondria. It is not doing anything to safeguard this mitothyroid connection. And that's the main reason that people with thyroid disorders are not feeling better, even though they are taking medicines, or even some people don't even take medicines and still they feel very awful. So that's the major reason. So the next question happens, people ask me is that, okay, well, why is my mitothyroid connection broken? Why? What is going on underneath which triggered my thyroid disorders? So again, research suggests that Hashimoto's disease, which as I said is a major cause of thyroid disorders, the actual reason of it is interplay between your genetic makeup and the environmental factors around you. Okay, there are several environmental factors which causes triggering of thyroid disorders, and we are going to discuss them in just a second. But just sit with this kind of information that it is an interplay between your genes and your environment. Now, most people will start blaming their genes. Oh, it is in my genes. I cannot do anything about it. But that is not true. Everybody has a set of genes, but their genes behave depending on what kind of environment you put them into. So if you put them into the wrong environment or environment which triggers Hashimoto's, then only you will get thyroid disorders. And the good part is that the genes can be turned on and can be turned off. So if your genes are turned on for some reason because of these environmental factors, you have ways of turning them off and improving the thyroid disorder. But that's the reason the mitothyroid connection is broken, or you have underlying thyroid issues because of these triggers in the environment which is present. So now let's talk about the triggers. So I have identified 5 major triggers which leads to all of the thyroid disorders. And that's what we're going to talk about. Okay, so these 5 triggers are food sensitivities, nutritional deficiencies, trauma, stress, toxins, and infections. So obviously these are big categories of triggers, and they are very much specific things which are underlying each and every of these triggers. And that's what we're going to talk about. But these are the main 5 categories of triggers that you should be knowing about. The worst part is that most people do not have just one trigger. It is a minimum of 2 or 3 triggers which are combined together leading to thyroid disorders. So again, a lot of people might think, oh, stress is my trigger or my food is my trigger, but it is not just one trigger. It's a combination of triggers which leads to Hashimoto's or thyroid disorders. So let's talk about the third trigger, which is the food sensitivities. So we call food as medicine, which is absolutely right, but the food can also be the cause of our certain diseases if we do not consume the right food. So why is this that, food is leading to, like all of these disorders and autoimmune diseases? And you might have heard a lot about things about food. So the reality is that our food genetic makeup is changing rapidly. With the recent industrial and agricultural revolution that happened all over the world, we have been constantly changing our food with genetically modifications, with using a lot of pesticides, spraying, all of those things. So our food genetic makeup changes. And our body recognizes each and every food to certain, sequences of genes, right? Because it has interacted with food for centuries or for millions of years now. Now, when your food is changing so rapidly genetic wise, your body is not able to keep up with this change, and it is not able to recognize these new foods which has been coming into the market. And that's the reason body thinks it's a foreign invasion or a foreign material being introduced into your body. And that's the reason it starts producing these antibodies, or food leads to triggering of Hashimoto's or thyroid disorders. Now, the common foods are here are gluten, dairy, soy, corn, processed food, sugars. All of these things are the most common food which leads to, triggering of Hashimoto's. Because again, these are the food which has been genetically modified the most, or these are the foods that your body cannot recognize anymore, and that's the reason they cause this issue. Now, the other thing which is very important to know is that there is difference between food sensitivities and food allergies. A lot of people will say, well, I don't have any allergies because I got tested. Well, they're checking for food allergies. Food allergies is kind of a situation where you consume peanuts, and if you're allergic to peanuts, you will blow up like a balloon and you will land up in the emergency room. But the food sensitivity is that, let's say you're sensitive to gluten, you will eat gluten. Your body will say, hey, gluten, you're not my enemy, but I don't like you here. So it will produce very, very small amount of antibodies to the point that it will not give you a full-blown anaphylactic reaction. But these antibodies start a very slow destruction of your body. So that's the reason food sensitivities goes unnoticed for a long amount of time, because they do not give big symptoms. Again, let's go on the research. So again, a systemic review was done on 12 research studies, which actually looked for association between thyroid and celiac disease, where people are sensitive or allergic to gluten. And it did show that people who have celiac disease also have very high chance or have high likelihood of developing thyroid disorders. There was another research study done which showed that, like people who consume more of processed meat, processed fat, and butters, they have a higher levels of thyroid antibodies in their body. So we have several of these research studies which link different kinds of foods with different kind of thyroid disorders. So it is very clear that wrong foods can definitely be a very, very big trigger of thyroid disorders. And it is unfortunate that, most people are not even aware that the food they are eating might be the reason of their thyroid disorders. So very important trigger, food sensitivities. I think everybody should be aware of it and start working on things for it. The next trigger that we're talking about is trauma or stress. Now, whenever I see a patient in my clinic and I ask them, the first question is that, okay, well, you got diagnosed with thyroid disorders. Just go back to that time and 1 or 2 years before you got diagnosed. Look at your life and see, was there any major stressful event? And time and again, 90% of my clients are able to identify some major event, whether it was a personal issues like divorce or difficult relationships or major work issues or major health issues, or even something called like, pregnancy, postpartum, like because there is so much hormonal changes which are happening in females that it can lead, which is a big kind of stressor for any kind of females, that can trigger Hashimoto's or thyroid disorders. So major events like, trauma and stress definitely is a major player, but almost 90% of my clients can identify some trauma or stress they went through, and a year or two later on, they were diagnosed with thyroid disorder. So make sure you are aware of it, because it is real. It is not again in your head. A lot of people think, oh, well, stress is stress. Everybody goes through it. But no, certain kinds of stress that your body doesn't like can actually lead to triggering of your thyroid disorders. The third big one actually is toxins. We are living in a toxic world and our system is being overloaded with toxins. Each and every day, more and more toxins are being poured into our environment and our body has to deal with it. The toxins, various toxins are involved in our environment, like heavy metals like lead and mercury, which we have known for centuries causes havoc to our body. Now new toxins are also being, introduced, like environmental toxins like, pesticides, insecticides, organophosphates. A whole bunch of environmental toxins are there, and plus mold toxins. There is clear-cut new research suggesting that mold toxins are very detrimental to thyroid disorders. People who do get exposed to mold toxins have high chances of Hashimoto's disease. and also have low levels of thyroid disorders. So mold is creating a havoc, and again, most people are not even aware of it. Again, let's look at a couple of research studies, heavy metals. So this was a research study done. And again, a lot of people have this misconception is that they need to be exposed to very high amounts of chemicals in their system to being diagnosed. A lot of people come to see me, well, I think I eat organic, or like there is no chemicals I use in my body, and suddenly we do a, like a checkup or a special test to check heavy metals or things, and boom, they have a lot of heavy metals. So what I'm coming at is that there is very low dose exposure that can happen to these chemicals because they're present in all over our environment. So this study showed that 54 male adolescents who were exposed to low levels of lead. Their results show that they have low thyroid levels, or they had thyroid disorders as compared to healthy males, which have never been exposed to any kind of lead. And obviously, they are looking at lead levels in their blood. And that's the way they know that they were exposed to very low levels, not even high levels, which will be called toxic, very low levels. And even then, that showed that they had higher chances of thyroid disorder. Again, another study that was done with people who were exposed to lead had higher chances of getting all different kinds of thyroid disorders. Not only hypothyroidism, but hyperthyroidism, and also thyroid cancer. So that's a major, major finding that you should be aware of, that even very slow or low exposure of heavy metals like lead and mercury can certainly cause issues with your thyroid. And unless you test it or unless you check them, it is very difficult to know whether those are the cases or not. So this was a study, like aspergillus is a mold. Okay, so this was a study which showed that aspergillus exposure. So aspergillus grows basically in a lot of water damaged buildings. So let's say, like, if you had flooding in your house, or ever, had any water leaks or water problems or plumbing issues, those things actually the water can seep in into the walls and the cracks, and that those damn buildings can create mold issues. So it was found that people who were exposed to any kind of water damaged buildings, they had high chances of developing thyroiditis or thyroid disorders, or they had low levels of thyroid in their body. So again, we have more studies that does show that the mold exposure can certainly be very detrimental to thyroid hormone production and also thyroid in general. And again, it's a very important factor to know about. And then again, there are several other studies which have shown a lot of correlation between pesticide exposure and develop of thyroid illness. So we have again several studies that does show that also, that there is a correlation that people who do get exposed to pesticides do develop thyroid disease. So again, toxins are a very, very important and a very big reason of developing thyroid disorders. Now, infections. Chronic infections or infections can lead to triggering of thyroid disorders. The most common infection that people might be knowing about is EBV, or Epstein-Barr virus, or infectious mononucleosis. There are at least dozen research papers which show the association of Epstein-Barr virus and its connection with thyroid disorders. Then there is Lyme disease, then there are several parasites which live in our gut, food poisoning. All of these things can actually lead to the triggering of Hashimoto's or your thyroid disorder. So again, we have a couple of research studies which I wanted to share with you guys, which is like, this study showed that 80% of patients with Hashimoto's patients and 60% of Graves' disease patient had Epstein-Barr virus reactivation. What that means is that, Epstein-Barr virus reactivation is different from acute infectious mononucleosis. This doesn't mean that you have actually an acute mono infection. So if you go to your regular doctor, they will check for a mono test, which will be negative. You have to go much more in-depth evaluation of your body to look for specific Epstein-Barr virus antibodies to know whether you have reactivation or not. But look at the numbers, 80% and 60%, that's pretty high. There was another study done which was looking at blastocystis, which is actually a parasite, which is kind of the most common parasite which I see when I check my patients, with special tests. And this parasite in the gut was again associated with thyroid disorders. So people who had this blastocystis in their gut had higher chances of developing thyroid disorders. And again, the issue is that this parasite doesn't even give symptoms. So it might be living in your gut for maybe years, and you might not even have symptoms. A lot of people will think, well, I should have diarrhea or constipation or stomach pain or maybe blood in my stools. No. Sometimes people have normal bowel movements and everything is normal. Still, they can have this parasite. So until you check for it, you will not know about it. So this is infections again are a very, very big cohort of triggers that people should be knowing about. So you see, these are the main five kind of, categories of triggers that, I showed the research that clearly shows that these are all associated, can be triggers of thyroid disorders. Whether it's infections, whether it is toxins, whether it is trauma or stress, or whether it is, like food issues or nutritional deficiencies, all of these things are related to thyroid disorders and lead to it. Okay. Okay. So now we spoke about, all right, you did figure out that you have a thyroid disorders. Maybe you know that you have the Hashimoto disease. Maybe you don't, but maybe you can ask your doctor to check for Hashimoto's disease. And then you think that, okay, you might know that, there are certain triggers, but what do you do about it? Okay. So that's what I'm talking about here. The 3-step process, which I have developed over the course of years, that will help you to develop actually and help you to reverse your thyroid disease. So the very first step is to identify the underlying triggers or the root causes of your thyroid disease, right? So that's a very, very important step. Now, this is also the most difficult step, okay, because we don't have very good testing available through conventional labs for each and every of these categories. Some of these things could be checked, but most of these cannot. But the good part is that, in functional medicine field, we have developed specialized testing, which we have ability to check all of these underlying root causes and can figure out which is your root cause. Okay. So for that, like you might have to find a qualified functional medicine doctor who knows how to do these proper testing and how to interpret these tests, or maybe a naturopath or a holistic doctor who can help you out with that. Okay. But over the course of research, what I've identified, I've identified certain patterns of clinical symptoms, which can maybe point us towards these root causes. So what I did was that I made this root cause quiz, which is hosted on my website. The address is going over here. So you can just go to this website and take this quiz. It will take you hardly 5 or 10 minutes. Ask you a bunch of questions about what kind of symptoms that you have. And in the end, it actually gives you a score. All of these 5 categories of root causes that we discussed about is going to give you scores in all of those 5 categories. So you will know that, which potential root causes you are dealing with. Obviously, this quiz doesn't replace any testing, but, at least, it's a good starting point for you to know what potential root causes might you be going through so that you can take some actionable steps to get them better. So this, as I said, the link is anshulguptamd.com/thyroid-quiz. And then that will take you to this web page. You can go on my website, anshulguptamd.com. And obviously, like the quiz is also over there and you will get the results. So that's the very first step. Okay. But what the common mistake that people make is that, they think there is only one root cause. And they think that if they find that one root cause, everything will be okay. What I have identified again through my experience and research is that most people have minimum of 2 or 3 root causes, which are working together to cause this thyroid disease. People come to see me, oh, well, my other doctor find out that, I have this parasite in my gut or I have candida in my gut and I did a treatment for it, but still have thyroid problems. I said, okay, well, what about toxins? What about other issues? And they said, well, he did not check for anything else. He found the parasite and he was happy that he found my root cause. And that is where we falter. We have to look at all the root causes, and unless all the root causes are identified and removed, the thyroid disorder does not get better. So it's very important to know all the root causes that you are dealing with so that you can reverse all of them and then you are going to see great results. Okay, so very important to know this step. The second step is basically like in thyroid disorders, what is broken? The mitothyroid connection. So what we are going to fix is this mitothyroid connection. Even though you address the root cause, we have to specifically fix the mitothyroid connection because which is something broken. It is going to take a long time for your body to fix it, right? So, but we have made ways, especially this mitothyroid diet, which can help to fix this mitothyroid connection very quickly. That's what we're going to talk about. Okay. So this diet has certain principles. The first principles is removing foods that are causing damage to the mitothyroid connection. Okay. So that we can at least stop the destruction which is happening, from happening anymore. So as I mentioned, those are basically gluten, dairy, soy, corn, processed foods, sugary foods, trans fats. All of the foods, are definitely very bad or detrimental for your thyroid. So you should be definitely, first step is getting off all of those foods. Okay. Now, the second principle, or the second thing is that, start adding foods which are going to be helpful for healing this mitothyroid connection. And we're going to talk in a second more about it, like good fats and high quality nuts and proteins. And the third principle is adding antioxidant foods. So again, what are antioxidants? Antioxidant foods are helpful for reducing inflammation in your body and also stops any further destruction of the mitothyroid connection, which are like green leafy vegetables, some fruits like berries, especially blueberries, blackberries, and then some gluten-free grains like quinoa and brown rice. So all of these things, are good antioxidant food that is going to start fixing your mitothyroid connection and obviously make things better for you. So why do you need to remove these foods, right? So we discussed a little bit about it because of all the processing which is happening to these foods and all the genetic modifications which is happening. The next question most people have is that, well, I am buying non-GMO, organic, gluten or wheat products. Is that okay? So still, our wheat has been modified so much that even the non-GMO varieties, our body rejects it. And gluten is the biggest trigger for Hashimoto. Same thing with dairy. Our dairy industry is heavily polluted and heavily processed. Even though you are drinking the best dairy products which are organic, still that can harm your thyroid. And we know the sugar is definitely bad, and processed food and processed meats. So all of these food needs to be given up because their industry is so heavily processed, and these foods are damaging to your thyroid gland day in and day out, that I recommend doing it, because it is just going to lead to more destruction and not help in fixing it. The good foods, let's talk about the food that you need to eat, right? So good fats. So again, the food industry has kind of created this fad about every fat is bad. Now, every fat is not bad. We need fat to survive. If we don't have fat in our body, we will not survive. All of the cells in your body have a lining around them, and that lining is made with fats. 70 to 80% of your brain is made with fat. So we need fat, but we need to include good fats. That's the most important thing. So good fats are olive oil, coconut oil, ghee, which is the Indian clarified butter or Indian ghee, which is good, which is very difficult, which is very different from butter. So people should be knowing about it. Avocados and fatty fishes. These are all good fats that people should be adding to their diet on a regular basis. That is going to help improve your thyroid functioning. The second is good quality proteins, like chicken, fish, turkeys. Those are all good quality proteins. Now, if you're a vegan or a vegetarian, then, you can choose like nuts and seeds, like which will be almonds, walnuts, pumpkin seeds, sunflower seeds, chia seeds, flax seeds. All of those things are great quality proteins. And obviously, you can also do beans like kidney beans, red beans, garbanzo beans. Those are all good sources of protein. Now, with the nuts and seeds and beans, there is some concern about lectins, and that's the reason a lot of people shy away from them. But we don't have first great research to suggest that lectins play a very, very big role. And second of all, there are ways to reduce lectins. One of the ways is you overnight soak them. And the second way is that when you're cooking them, you do pressure cooking. So if you pressure cook them and if you soak them overnight, you reduce the amount of lectins. So I think those are perfectly fine then to use. And the third thing, as I said, nuts and seeds, like chia seeds, like flax seeds, almonds, walnuts. These are again very good sources that we should be eating. Good quality fats, good quality protein, a lot of antioxidants, a lot of benefits of nuts and seeds that, for thyroid patients. Some more good foods, some more good foods are like non-starchy vegetables, as we discussed. So any kind of vegetables, non-starchy vegetables are perfectly fine, whether it is green leafy vegetables, whether it is like cucumber, salads, even cruciferous vegetables. That's again a bigger myth that goes around, is that cruciferous vegetables, any thyroid patient should not consume it. Again, the research is very old on it, because the cruciferous vegetables sometimes interfere with iodine absorption and utilization in thyroid. But as I said, most people now these days are not deficient in iodine. The problem now these days is autoimmune inflammation, which is leading to destruction of the thyroid gland. And cruciferous vegetables have great antioxidants. They have sulforaphanes. They help with detoxification. All of these things now show that they help the thyroid patients. So again, please consume a lot of these non-starchy vegetables. They are going to help your thyroid, to get better. Certain fruits, again, fruits do have sugar. So I don't recommend eating a lot of fruits, but certain fruits can be helpful, like blueberries, blackberries, very like limited amount of strawberries or apples can be useful. Gluten-free grains like quinoas, oats, or brown rice is also fine to do. They will also kind of help you with improving your thyroid functioning. Okay. So the message in mitothyroid diet is very simple. Okay. Remove foods which are bad for you, include foods which are good for you. In this diet, we don't focus on the calories, and instead of focusing on the quality of the foods. And this is again very important for most of the thyroid patients to know, because most of the thyroid patients have always been thinking about calories. Well, I should be just eating very limited amount of calories, 1,000 calories or 1,200 calories, or that's it. No, that doesn't work. Okay, because your thyroid needs quality ingredients. So it is not about the calories, it's about the quality of the food. So if you eat good quality food, your thyroid is going to get better. Okay. All right. There are certain supplements which can support thyroid and mitochondria and help support this mitothyroid connection, helps improve your thyroid in a whole bunch of things. Okay. Again, obviously, before taking any supplements, always recommend discussing it with your healthcare provider just to be sure it is fine with you. So number one is zinc. Okay. Zinc is a great supplement, is wonderful for immunity, but it is also great for thyroid, gland also, because it helps with the thyroid hormone production. It also helps with converting your thyroid, inactive thyroid hormone, which is the T4 to T3. Okay. And which is a major actually player, because a lot of people, when they're taking this medicine called levothyroxine, they don't even know that it's only T4. Okay. So your thyroid hormone produces this hormone called T4, which is inactive thyroid hormone, and it needs to go to the cells of your body and then needs to be converted to T3. So your body can actually utilize the thyroid hormone. And some people are just not able to do it. Okay. There's this conversion from T4 to T3. And the major reason can be zinc deficiency. Okay. So zinc actually helps out with conversion of T4 to T3, and there actually people feel much better on it. Different forms of zinc, but the best forms of zinc, so again, when you're buying a zinc supplement, just look at what kind of zinc it has. So zinc glycinate or zinc picolinate are the best form of zinc, which are best absorbed. So those are the ones that I would recommend to you. And, the dosage varies between 30 to 50 milligrams, but, that depends on person to person. The next supplement is selenium. Selenium again is great. It reduces inflammation. Selenium has at least a dozen studies which shows that taking selenium can reduce the thyroid antibodies. It improves Hashimoto's. It improves thyroid levels. It again safeguards your thyroid gland. It improves thyroid hormone production. So very great supplement. The best form, again, selenium comes in a whole bunch of different forms. Selenium methionine is the best form of selenium that you should be utilizing. Magnesium is again a great supplement, comes in different forms, depending on person to person. Now, the way magnesium helps with thyroid patients, it actually helps with the iodine uptake. Your thyroid gland needs iodine, so it helps your thyroid gland to uptake the iodine into it. It helps with thyroid hormone production, also helps in reducing inflammation. So all different benefits, which magnesium provides. But the different forms of magnesium available in the market, like the magnesium glycinate is the one that I like the most because has a very calming effect and doesn't have much side effects. So magnesium glycinate is the one that I like, and then the dosage varies from person to person. Vitamin B12, again, a very, very important vitamin to use. There was actually a couple of research studies which shows that a lot of people who have thyroid disorders are also low in vitamin B12. Because, again, as I shared with you, that the thyroid disorders are mainly autoimmune in nature. And there is a condition where your gut is not, which is called pernicious anemia, where your actually gut doesn't produce an intrinsic factor, which is responsible for absorbing B12, into your body. So that condition can be there and you will not know about it, and your B12 levels might be on the lower side. So that's the reason, I recommend taking B12 supplements. And again, as your gut is not able to absorb B12, then taking sublingual way of B12 or maybe injectable is better, because that way you are absorbing it directly into your body. Vitamin D, at least 50 research studies shows that vitamin D is good for thyroid patients. Whole bunch of benefits, from vitamin D. It regulates inflammation, reduces inflammation, helps thyroid hormone production, supports the thyroid gland, whole bunch of things. The dosage varies anywhere from 1,000 units to 5,000 units for people, depending on where they are. Coenzyme Q10. This is a great supplement which supports the mitochondria as well as the thyroid. Okay. It is a great antioxidant. It reduces inflammation in mitochondria. It provides more energy. It helps with fatigue, tiredness, brain fog, mitochondrial functioning. So great supplement that I recommend to my thyroid patients so they can see the benefit from it. These are some supplements. Obviously, these are some basic supplements which I think almost a lot of the thyroid patients would benefit from. But obviously, there are advanced supplements that could be useful. Now, that's the step two, which was fixing the mitothyroid connection, mitochondria and thyroid. That's where we talked about the mitothyroid diet and some supplements. The step three is removing the toxicities which are not letting your thyroid heal, okay? Which is stress or trauma, toxins, and infections, okay? So stress is very important. Most people do not take this step very seriously. And I tell each and every person that stress management is very important, especially the world we are living in, or even though you are living in an offbeat place or you think that there is not much stress in your body. When you do have a thyroid disorder, at least you have thyroid stress. Your thyroid is stressed out. That's the bottom line. And any of these things that you do, whether it's deep breathing or any other stress management techniques, directly affects each and every part of your body, including thyroid, and improves the functioning. So various ways of doing it, deep breathing exercises, which helps to reduce stress or activates the parasympathetic system in your body. There is a 478 method. If you will Google it up, you will see very easy. Anybody can do it. There are several videos where people show exactly how you can do it. Takes hardly 5 or 6 minutes to do it. So again, you can do it anytime, even in your office, even in your workplace, at home, in your breaks. Nice way of doing it. Nature, spend some time in nature. Go for a walk, go for a hike, go for a picnic, right? Nature is very, very calming to your thyroid. Meditation, again, if you want to go a step further from deep breathing, then you can start doing a meditation practice, which again can help to rebalance your parasympathetic system, rebalance your thyroid hormones and other hormones also. Acupuncture, again, if you want to take it one notch up and you want to do acupuncture definitely helps to rebalance your energy in your system, definitely is very helpful for stress management. Detox. Now, this is a step which I don't recommend anybody doing it on their own. Like there are some basic things people can do, but a lot of people are going online and buying detox products and a lot of different supplements or detox regimens. I don't recommend doing it because that backfires. Because detox is very complicated. First, we need to know what kind of toxins we are dealing with. And second of all, we need to make a stepwise plan to fix it. Okay. But some basic things like, we detoxify through our gut. Okay. So these are like, we detoxify through basically 5 different channels. So these are the channels that you can optimize. The first channel is through our gut. So drink lots of water, eat lots of vegetables, eat a lot of fiber. Make sure you are having regular bowel movements. Having a bowel movement every 2 or 3 days is not regular. Okay. So you need at least one bowel movement every day. That is the regular bowel movement that you're dealing with. Through your kidneys, so drink lots and lots of plain water. Okay. Caffeinated beverages or sodas and other things do not count. You need to drink plain water to help with your detox. Through sweating. So again, doing a workout, like walking, jogging, running, or doing saunas. Those are great way through sweating, which can help with detox. Through our lymphatic system, this thing again helps with a detox. So again, doing dry brushing or regular workout would help with your lymph flow and will help you with your lymphatic system. And through your liver. And again, the liver detox mainly helps with your diet, right? So make sure you're eating foods which support your liver health, okay? Which are like, turmeric, ginger, cruciferous vegetables, artichokes, all of those foods, like which have a lot of colors in them, they all support your liver. Okay, so that will be wonderful to help with your detox. So this is the second thing that you can do. The boosting your immunity. Okay, now we definitely want to improve our immunity, and that is where the anti-inflammatory diet, which is a mitothyroid diet. So mitothyroid diet, when you're removing those foods which reduce your immunity and then including the foods which improves your immunity. So mitothyroid diet not only improves your mitochondria and thyroid, but also boosts your immunity. So you can certainly do that. Now, again, another benefit of stress management techniques like meditation, people don't know, is that actually it improves your immunity. Again, this is research which shows that, like meditation can improve your immunity. Okay. Again, sleep is very important. Make sure you're optimizing your sleep. Okay. Because that helps with your immunity. And obviously, we know certain supplements like probiotics, vitamin C, vitamin D, omega 3s. These supplements can also support your immunity. Okay. So this is again how you can fix your immunity. Okay. So this is kind of the three steps, which, easily can help you reverse your thyroid. Now, I want to share this kind of, a case, of, or a story of one of my client who worked with me to kind of get an idea of how this can be life changing for you. So this is Wendy. She came to see me a couple of years ago, actually now. So she was a 37-year-old female who had thyroid issues, low thyroid or hypothyroidism for more than 5 years. She was taking levothyroxine each year, or slowly and slowly her levothyroxine dosage, which started at 50 micrograms, now was already up to 100 micrograms. Even though she was taking this medicine, still she had symptoms. She was unable to lose weight. She was doing crazy diets with like just 900 calories. She even hired a personal trainer to do exercising and still was not able to lose weight. She was having these anxiety episodes. She was having low mood issues. She was just not feeling good. She was feeling tired all the time. Even she was so tired that she had to take a couple of naps, or even one nap, a minimum one nap, just so that she can go through the whole day. She was so tired. And she had gut related symptoms. She was feeling bloated, constipated, and sometimes diarrhea, alternating with constipation, stomach cramps. All of these symptoms are there. And just minded that she was taking levothyroxine and her numbers were in range according to a regular doctor. So when she saw us, obviously she has tried everything. She tried all these different diets, she tried supplements on her own, but nothing was working. Okay. So the first thing we told her that we need to find the root causes. So what we identified after doing a complete evaluation on her was that she had food sensitivities to gluten and dairy. She had a lot of bad bacteria in her gut and she had no idea about it. She had more toxins in her system, and she was also low in a lot of vitamins and minerals. Especially she was low in zinc and she was low in magnesium, and she had no idea about it. So then what we did, we actually made a very simple stepwise plan to address all of these root causes, and which were done very easily through diet changes and through adding some supplements. And within 4 months, phenomenal results. 15 pounds is what she lost, while she was struggling to lose a single pound in 5 years. With just these changes, 15 pounds she lost in 4 months. Her energy levels improved dramatically to the point that she had to do not have to take a nap. Like she was so good in energies. Brain was working better. Her bloating was gone. She was having regular bowel movements. And even her thyroid numbers improved dramatically, and her thyroid antibodies went low. And a doctor had never seen antibodies going low. Like her antibodies, I think, was somewhere in the 600 ranges, and they come down to like 50 ranges. And a doctor was totally perplexed of what was going on. So this was her, right? Like coming with all these symptoms or going through a lot of things 5 years. And with the three-step plan, she was able to lead her life very, very quickly and easily. So I just want you to have this message. Don't let anyone tell you that there is no hope for you to get better. There is hope for you to get better with thyroid disorders. Through this three-step process, you can take control of your thyroid back again. There is light at the end of the tunnel. So please take these steps. Please take an action, and you will see great results. I hope this makes sense to you. I hope you like this video and the presentations. If you want to connect with us, I have lots of information on my website, anshulguptamd.com, several blogs, several videos. Follow us on a YouTube channel. I share new research and new things which are coming up for thyroids that can be life changing for people. You can always get my bestseller book, Reversing Hashimoto's, available on Amazon. Again, that will help you to understand and again give you much more details about things that we discussed about. And if you do decide that you want to take it to the next level, you want to work with us, then we offer online consultations from anywhere in the world. You can easily work with us. Again, go on our website and all the information is over there. I hope you like this video and it makes sense to you. If you have any questions, again, please feel free to email us or reach us back. Go on our website and you can contact us from there. All right, guys. Thank you so much. Bye-bye.